Welcome back. Today's topic is young onset dementia and the sixth and final part of the six-part dementia series. Rather than covering all types of dementia in one video, I have divided this into 6 individual parts so you can watch the one you are interested in. An estimated 7.5% of the people living with dementia in the UK are living with young onset dementia, where symptoms occurred under the age of 65. The age was between 30 to 64 for young onset dementia patients, and it is 92 per 100,000 of the general population. The young onset dementia rate is higher in ethnic minorities as compared to the overall UK population, and unfortunately, ethnic minority dementia sufferers are less likely to receive a diagnosis or support. Then people with the learning disability are at greater risk of developing dementia at a younger age. Studies have shown that 1 in 10 develops young onset Alzheimer's disease between the age of 50 to 65. The number of people with Down syndrome who develop Alzheimer's disease is even greater. As with dementia, generally, there is conflicting information about the prevalence of young onset dementia. The low levels of awareness and the difficulties of diagnosing the condition at working age mean popularly used statistics are likely to be inaccurate and do not reflect the true number of people who are affected. So the number quoted earlier might be low as compared to the actual numbers. Dementia is a degeneration of the brain that causes a progressive decline in people's ability to think, reason, communicate, and remember. Their personality, behavior, and mood can also be affected. Everyone's experience of dementia is unique, and the progression of the condition varies. Some symptoms are more likely to occur with certain type of dementias. Let's look at its development. The early symptoms of young onset dementia may not be memory loss. Some symptoms can differ from one person to another depending on the type of dementia a person has and which parts of the brain it affects. Dementias affecting the frontal and temporal lobes of the brain are more common in younger people, so it is more likely that the early symptoms may include changes in personality, behavior, language, social functioning, relationships with others, activities of everyday living, motivation, mood, for example, depression and anxiety, concentration levels, decision making and problem solving, vision and spatial awareness. There is a strong possibility that the person is reluctant to accept their reality and avoid visiting the GP to get this diagnosed. Early recognition and timely, accurate diagnosis of dementia combined with appropriate specialist support can reduce the distress experienced by the person with young onset dementia and their family. Let's look at the diagnosis of young onset dementia. On average, a person may see between 2 and 5 different consultants before a diagnosis is made. The average time to diagnosis is 4.4 years in younger people compared to 2.2 years for people aged over 65. In 2018, in England only, the estimated dementia diagnosis rate was 41% for under 65, whereas it was 68 in over 65 years old. Awareness amongst GPs is still relatively low, and when people are younger, symptoms are often attributed to stress, anxiety, depression, or menopause in women. People who are under 65 are more likely to be diagnosed with the genetically inherited form of dementia or a rarer dementia that can be difficult to recognize. Let's look at some figures on common types of dementia in younger people. There are differences in the types of dementia commonly diagnosed in younger people with dementia compared to those of an older age. The first one is Alzheimer's disease is the most common form of dementia in younger people. 1/3 of younger people with dementia suffer from Alzheimer's disease in comparison to about 60% in the older age group. Second one is vascular dementia is the second most common form of dementia in young people. Around 20% of the younger people with dementia have vascular dementia. Then around 12% of younger people with dementia have frontotemporal dementia, compared with just 2% of older people. It most commonly occurs between the ages of 45 to 65. In about 40% of cases, there is a family history of the condition. Then there is another type called Korsakoff syndrome. Around 10% of dementias in younger people are caused by a lack of vitamin B1, which is also called thiamine, most commonly associated with alcohol abuse. Then around 10% of younger people with dementia have dementia with Lewy bodies. Around 20% of young people with dementia have a rarer form of the condition. Examples include conditions that can lead to dementia, including Parkinson's disease, Huntington's disease, and Creutzfeldt-Jakob disease. Younger people are more likely to have rarer familial forms of dementia caused by genetic mutations, including familial Alzheimer's disease, familial frontotemporal dementia, and familial vascular dementia. Familial means family history or the disease runs in the families. To conclude, let's look at the symptoms of all the dementias that will help spotting the disease. The symptoms of dementia include changes in short-term memory, thought processes, concentration, communication, comprehension and word finding, motivation, ability to perform everyday tasks, personality, mood, behavior, or social functioning. However, all of these symptoms can be caused by other conditions such as depression and underactive thyroid or vitamin B12 deficiency or medication side effects. So it's important to see a GP in case there is a cause that may be treatable. Today's topic is the first part of the 6-part dementia series. Rather than covering all types of dementia in one video, I have divided this into 6 individual parts so you can watch the one you are interested in.